So speaking, I know you're a technologist at heart, Rob, and so talk about the innovative approaches and kind of the underlying tech that you use to develop this.
Absolutely, but first we're gonna have to add 2 new tests, I think, to our system. One is the mama bear test. that's definitely gonna be the mama bear test, right? Does it pass mama bear test? And the other will be on the dashboard, days since CEO called, right?
Yeah. Love it.
But those are awesome. I had actually not heard the mama bear test, so that's exactly why I got into this, right? Like that psychs me up. I've done some cool stuff, but that's exactly why we did it. And it's why we took the hard way to solve this problem. The easy way is to get a bunch of data and run a data regression against it and say, you're kind of like this group of people, and so we're gonna say yes or no based on that. But that's not actually clinically correct. I'm not like him because our height and weight are the same or whatever. He's lighter than me. But really, I'm an individual, and everybody's an individual, and we all have our own unique medical histories. We have our own unique family histories. That's why we make doctors go to medical school, right? That's what they're doing in there. It's not just hanging out all night, trying to drink caffeine to keep up. It's really so they can learn to identify us and our unique clinical criteria. And that's what I built the system to do this. God, that is egotistical. A team, I have a great team. And that is a really a big part of it. We have a very unique team too. Our team is not a bunch of computer scientists. We have doctors, we have nurses, we have a whole team of people who sit there and send in authorizations all day to all of your portals. The reason I employ them is because I want to know exactly how that works and exactly what I needed to do to make it better and to make it work faster, and all of their complaints about all y'all's portals. I've lived in Florida a little while now, so I can y'all a little bit. And so what we really did is we started with that basic premise. We want to do authorizations in a clinical manner. We want to do them just like the doctors and nurses who are looking at these would do them. So we don't have to have those nurses. We can have them, very few people went into nursing to become a paper pusher. They're the kind of people who want to help people. They're the kind of people who want to really go out and touch people and help people and get them well. And I love that about them. That's not my instinct, nor is it my skills. But I want them to be able to do that. Why should we have them pushing papers around? Which is really what we've done with a lot of them. And that's terrible use of human power, right? And so we went in and we took all of these parts of the medical necessity rules. We said, okay, you're the payer, your chief medical officer has gone through and they've defined the rules of this game. And we codify those rules of that game into something we call real medical language. And what that enables us to do is 2 things. One, we reduce the cognitive load on these people who are trying to operate your portals. We give them simpler questions. Have you ever read the questions? They're kind of made by a doctor and a lawyer locked in a room with too much caffeine. And I'm a logician by training. Ands, nots, and ors, I would literally be drawing truth tables to figure out if I had a positive result on this test, whether I should say yes or no to the question. They're that hard. It sounds funny, but it's not funny. That's really how hard some of these are. And so we reduced the cognitive load on these questions, and we simplified them. And actually, one of the work products is by sending those back to Florida Blue, they did a huge rewrite this year of taking some of the harder things out and saying, okay, you guys have a point. I made sure that our doctors did all of that work, right? That's not something that our computer science people do. That's not something that I let my data scientists do. That's all done by our clinical team. And by lowering that cognitive load, we now have questions that you can answer, but my AI can also understand. Then we go in and we get your clinical history. And we read your clinical history just like a nurse or a doctor. But you know what? We're more attentive. Because we didn't have a bad morning. Our dog did not poo on our shoe, right? We read it the same way every day. There are advantages to computers. Sometimes there are tasks that we can do better than humans now, and this is one of them. This is why I knew I could solve this problem. The advances that you're seeing in ChatGPT are the types of advances that we made a couple of years ago in this type of system, where we can recognize and understand the actual clinical concepts in your clinical documents. So we now have this. Here's what Rob has. Here's what the rules say. Is he allowed to get this new hip? Does he meet medical necessity for this new hip? And that's how we do it. We match those up. Now, sometimes we need a little extra information, just like anybody does, and we ask the operator to either give us more clinical data or they have to do some attestations. But what we find is very quickly after they get a 90-second real time, I landed rockets, picoseconds is real time, 90 seconds is human time. That's the term I use. But after they do that, they always start giving us clinical documentation, because they don't want to have to call up later. They don't want to have to log into the portal to see, you know, Joe called me again about, is his surgery approved? Can I schedule it? Can I schedule it? And then the doctor calls and says, hey, I've got an open slot. I need to do a surgery. Get me somebody authorized. They have a bad job. That's a hard job, right? And by making this instantly, they're just done with this. They can go and tell that person, that human being in the room now, yes, we have finalized, you're going to get this authorization, you can schedule it, you can make your plans, you can figure out when you're going to take time off, or all those things that affect our lives when we have to go out and get health care. You can go and take care of those. And so that's the other huge advantage of this speed. What gives us speed? Because we built this system essentially infinitely scalable. I looked at how many prior authorizations were done in the US in a year. I said, we're going to build a system that can do 10x that number and handle it easily. I have a background in very high-speed computing, and we built this on brand new technology. We're already in the cloud, everything's secure, and it's essentially infinitely scalable.